In this presentation, I will be covering the eating disorders bulimia, anorexia nervosa, and binge eating disorder. Eating disorders are abnormal behaviors involving food and are due to psychiatric conditions. There are many causes of abnormal eating habits, but if the situation is better explained by another medical problem, it is not classified as an eating disorder. For example, a repressed patient that loses their appetite has an abnormal level of food intake, but does not necessarily have an eating disorder. This discussion will be focused on anorexia nervosa and bulimia nervosa and their similarities and some differences. In both cases of anorexia nervosa and bulimia nervosa, the patients are preoccupied with food, their physical appearance, and how much they weigh. They may have low self-esteem due to their disordered self-image. These disorders are significantly more common in females, young females at that. And the treatment for both of these disorders are primarily focused on SSR, antidepressants, and various types of psychotherapy. There's a significant amount of overlap between the presentation of bulimia and anorexia nervosa. The key distinguishing factors is the patient's BMI, which is very low in anorexia nervosa and normal or mildly elevated in bulimia nervosa. You cannot use the presence of purging activities alone to distinguish between the two, because patients with anorexia can use things like laxatives and intentional vomiting, just like bulimia nervosa describes periods of overeating, also known as binging, followed by compensatory activity. Patients feel out of control during a binging episode. Their BMI tends to be between a normal limit or even slightly high, contributing to their feelings of loss of control. There are a couple of signs that can help you diagnose a person with bulimia. For example, bulimic patients tend to vomit. Signs of purging may include going to the bathroom after meals, frequently disappearing after meals, or taking a trip to the bathroom to throw up. Patients often use disguises like running water so that you can't hear them vomiting. Using laxatives, diuretics, and enemas after eating, may also take diet pills to curb appetite or use the sauna to sweat out water weight. Excessive exercising is another sign. They work out, use strengths, especially after eating, and typical activities include high-intensity calorie burners such as running and jogging. The term anorexia is used often as a descriptive term for loss of appetite and result in weight loss. Note that this is very different than anorexia nervosa, which is sometimes abbreviated as anorexia. Anorexia can be used to explain any disease or illness or a side effect of a treatment. It is not psychologically in origin. In fact, patients with anorexia nervosa do not technically have anorexia because they usually have a very strong appetite and feel hungry. The presence of an appetite can be used to differentiate anorexia nervosa from things like depression, where patients lose appetites and their appetites entirely.